An abdominal aortic aneurysm is an enlargement of the abdominal aorta, which is the main artery that takes blood flow from the heart and distributes it to the rest of the body. There are many risk factors involved with aortic aneurysms, but some of these are smoking, which is a very common risk factor. Being a male, typically males are 4 times higher risk than females would be for aortic aneurysms. High blood pressure, cholesterol, a lot of the typical things you see with heart disease are risk factors. And then also, if you've had a family member that has had an aortic aneurysm, you have about a 12 to 15 times higher chance of developing one yourself. So there's a genetic component to it. So aortic aneurysms are typically what I would call a silent killer. Most of the time, patients are not aware that they actually have an aortic aneurysm, and so they might have a kidney stone, get seen in the ER, get a CAT scan or an X-ray, and find this by accident. So most of them are asymptomatic, don't really produce any pain or anything like that. As far as screening is concerned, I would say a good physical exam is probably the most important part of all of this. And every physician, regardless of your specialty, whether you're internal medicine, family practice, general surgery, vascular surgery, whatever your specialty may be, are well equipped to give a simple abdominal exam and feel for an aneurysm. So that's what I would say would be the starting point. After that, you have ultrasounds, which are used widely for screening in patients with a lot of risk factors. Medicare has a free screening that is built into the Welcome to Medicare packet that you can fill out and obtain, and I would recommend that you do that. Once a patient has an aortic aneurysm, or once we identify that one would have an aneurysm, it's very important to keep an eye on it and do what we call surveillance. And that means a periodic ultrasound, usually every 6 months or every year, to track its progress. They don't grow at a predictable rate, so it's important that you keep checking on them periodically. Once they reach 5 centimeters in diameter, that's usually the point at which we would consider doing some type of repair. In the vast majority of times, we repair aneurysms through what we would call an endovascular approach. And that's a method where we insert a stent inside the aneurysm that seals off the aneurysm from the pressure, so there's no longer any pressure on the aneurysm. And this has really changed the entire field of vascular surgery. We now can do this in a matter of 30 minutes to an hour without a single stitch in the groin. It's called percutaneous. We do it without a single stitch, just a Band-Aid, very similar to a heart cath actually. The patient is awake and fully cooperative, and we put the stent in and they go home literally the next morning. So that's a real dramatic change from what we've seen historically with aneurysm surgery. And I would say in our practice, we probably do this 95% of the time or greater. The results of treating aneurysm surgery are very durable. If you happen to require the traditional repair, we know that has a typical 30-year durability in general terms. So it's it's probably the most durable way to do it. With the stents, they're a little less durable in general terms, but we're learning that they can last for decades as well. And we have to just continue to monitor the progress of the aneurysm, because the aneurysm is still in place. We don't take the aneurysm out when we put a stent inside of it. So we always have to keep an eye on it, and I always talk to the patient about lifelong surveillance or follow-up. But I've been doing this since 2001 now, and I have patients that have had stents all the way back to 2001 who are doing just fine almost 20 years later. What I think sets Longstreet Clinic apart from other vascular practices are really 2 important things. Number one, our wide diversity in terms of our background. All of us have trained at different institutions all across the country, and we have different perspectives, and that really brings a very good sense of seasoning to our practice when we deal with patients and complex issues. So I think our broad background is a real strength. So that's one thing. The second trait that really separates us, I think, from the others is that we actually pride ourselves in spending a lot of time with our patients, making sure they understand what they're about to go through, And we, I believe, provide a significant human touch to what we do. These patients are all scared. Their families have a lot of questions. This is a very difficult time in their lives. And we really try to provide the human connection to all of this. In addition to, our surgical expertise, which I feel is second to none, we also provide a human connection that's really important.